The wearing off symptoms occur frequently in patients using natalizumab and usually consist of an increase of MS-related symptoms just prior to the infusion. Mainly fatigue is mentioned. Extended interval dosing is becoming more popular, where the treatment interval of every 4 weeks is prolonged. But the influence of extended dosing on these wearing off symptoms is not fully understood yet. And this might cause hesitancy in starting or continuing extended dosing if patients feel the need for their next infusion. So the aim of this study was to investigate if starting with extended dosing can increase the frequency of wearing off symptoms and also any changes in time of onset or severity of wearing off symptoms. We studied this in a subset of the Next-MS trial on personalized extended interval dosing. And we offered patients questionnaires at baseline and during follow-up about these wearing off symptoms. We created 2 groups depending on the amount of interval extension. So if patients had at least 1 week of interval extension during the study, they were included in the extended group. This was 171 participants. And the other participants were included in the fixed group. And the fixed group were all patients with a fixed interval during the trial, either standard or extended dosing. And the total amount of participants was 255. We saw that the onset of the odds on occurrence of wearing off symptoms did not change over time. And also the severity and frequency was stable over time, also in the extended dosing group. And we also looked at the amount of weeks added to the treatment interval or the decrease in drug concentration, if this has any influence on wearing off symptoms. But we saw that this also was not influencing the frequency of wearing off symptoms. It is important to mention that our study was non-randomized, so this introduces a selection bias into the study group, and also asking specifically about wearing off symptoms can increase the awareness of patients and might lead to attribution bias. But still, to summarize, we saw that wearing off symptoms were not reinforced by further extending natalizumab treatment intervals in our study. And some patients might experience an increase, but this seems unrelated from a decrease in drug concentration or the amount of weeks added to the treatment interval. So most studies on wearing off symptoms in natalizumab, they report similar symptoms, so mainly fatigue. And in one previous study, we saw higher EDSS scores were associated with wearing off symptoms, and also a positive association with body weight was repeatedly found. There was also a study suggesting that this might have something to do with the receptor occupancy on lymphocytes, also in patients with a higher BMI. But this was not confirmed in another study, so the results are a bit conflicting. In a previous cohort of our study group, we also investigated the drug concentration or receptor saturation, but these were also not associated with wearing off symptoms in general. But they still occur frequently in patients with MS, and they can maybe cause hesitancy in starting with extended dosing. So we also looked at some data that was available during the COVID-19 pandemic. 2 studies also looked at extended dosing. One study saw no increase with extended dosing of natalizumab, and one study did saw an increase of wearing off symptoms with extended dosing of natalizumab. And this study, the increase was also higher in patients who already experienced wearing off symptoms during standard dosing. And in our study, we did not see an increase in occurrence, frequency, or severity of wearing off symptoms. So that adds to the existing literature. And I think it's important that neurologists just discuss this with patients and also any hesitancy there might be with extended dosing and wearing off symptoms, and discuss this together when they discuss the treatment with natalizumab.